It is my pleasure now to introduce Andrew Abumoussa, a Ph.D. student at the University of Rochester, who will present healthy insights in real time. Welcome.
Thank you. Good morning, everyone. I'm Andrew Abumoussa, and I'm representing the Artificial Intelligence Lab at the University of Rochester. I'm really excited to be here with you guys at the Datapalooza, and I'm really excited to show you how we can use techniques in artificial intelligence, natural language processing, and machine learning to extract insights in real time. We are creating a tool that will empower policymakers, healthcare providers, and other officials to better understand diseases as they develop. So what you're looking at now is a map of New York City, and on this map are sick individuals. So the way we identify who's sick is through Twitter. It's a pretty unconventional method, but when you think about it, Twitter is a great platform to do this. With Twitter, it's an open data set. Tweets provide us with GPS and timestamps, and also it's a platform that removes any sort of bias. So people have no incentive to lie, it's just a stream of conscious. So as people tweet and conversations are happening on Twitter, we're looking at every single tweet and identifying the ones that are health related. So then we display them on a map, like so. The colors on the map indicate how sick an individual is. And let me just show you what that might look like. So Kim Z, 1017, says that, "Please stop, I'm sick over here crying." Okay? Now, something that might indicate a positive emotion or positive sentiment shows up in green. Let me pick a better one. This person says, "It's nice out, I should have called in sick." Right? So we're able to infer the health of individuals based on what they say. So there are cases where we can't infer the exact health status of an individual. Someone might say something like, "I have a headache, hope I'm not getting sick." We can't pinpoint whether it definitively indicates the person's sick or not. Okay? So this is a snapshot of real time. What we can do is, as this happens, we can animate it, and we can actually see how sickness is developing. We can transform that view and group individual tweets into aggregates and create heat maps of sickness. So you can see sickness developing in real time. This is a map of New York. Now, the greatness with artificial intelligence is we can take multiple data sets, view how they interact, and from those interactions, expose insights. So let's say we're interested in finding out how known pollutants from the EPA affect health. So what we can do is overlay the information from the EPA, and these are these purple pins. These are known pollutants. And then you can begin to understand whether sickness is in fact sickness or it's related to a pollutant. So let me just pick one pollutant out. So you can see what the pollutant is. This is some airport base. And then you can watch this to understand, okay, if I put a gas station in a corner block, does that affect health? We can do other things. So let's say we're interested in how traffic affects health. Is traffic a factor as a pollutant, or does it help spread the disease? We can overlay real-time traffic data from Google and then begin to inform our models. So as the traffic begins to overlay, you can watch the interactions between how sickness is developing. You can inform and understand whether traffic is spreading, or you can see if congestion affects health. That's the 1,000-foot view. We can zoom in and do even cooler things. So what you see here is an individual, and with this individual is their social network. So we do some pretty tricky things behind the scenes. In academics, we have to increase the probability that these people are going to interact with each other. So we have a stringent definition of a social network, and it's reciprocal friends who have tweeted within 24 hours, within 15 miles of the individual. So by doing that, we can assume that there's a high probability that these friends are going to interact. So the individuals in the center, they're that pin with the black dot on it, right here. And around those are her friends. And they're graded based on their health. This does a few things. It empowers the individual to understand what health looks like around her. It informs her of patterns, so you can see across the river, a few of her friends are sick. And you can make decisions such as, let's avoid areas with high densities of sick people. We can do something else and understand how multiple social networks affect each other. So you can begin to answer questions like, how do my friends of friends affect my health? But even more powerful than that, it provides us with the ability to identify outbreaks. And it's a subtle point. So what we're doing in academia is we're looking for social graphs with high densities of sick individuals. That cues us that a number of individuals got sick at the same time. So in historical data, this was in 2010, we found a cluster of a social graph that had a high density of sick individuals. What we were able to do is ask, where were these people when they got sick? Or why did they get sick? So we can look at their historical tweets and identify previous locations. And we were looking for intersections. We found a cluster within a historical social network, and they all went to the same, I won't say the name of the restaurant, it was some popular fast food chain, in 2010, 3 days before. What's powerful is that it took the media 4 months to identify that specific restaurant as a source of salmonella outbreak. So that's what we're doing with Twitter. But so far, we just talked about a nebulous idea of sickness. What if we could instead take sickness and refine it to a specific symptom? And looking at those symptoms, understand how exact diseases spread across the United States in real time. We can do things like this. We can create an interface for policymakers to understand how specific diseases are developing, where they're developing, and why they're developing. We can create heat maps of specific diseases, hopefully to help contain epidemics. We can equip first responders, hospitals, and emergency responders with insights into what they're about to encounter in their environment. We can show you, hey, this is what people are saying that results in these diseases. So this is the lab at the University of Rochester, headed by Dr. Henry Kautz and research partner Adam Sadalik and myself, and a group of undergraduate researchers. And we are honored to be here. We're really excited about the Health Data Initiative, and as more data becomes open, this is the type of interactions that we can provide. We're really excited to watch as policymakers begin to open other data sets. Imagine what we could do with electronic medical records. The privacy issues aside. But I just want to conclude with this. As other data sets are more open, we hope to expand and refine our models. Ultimately, our goal is to change the state of healthcare from a reactive practice to a proactive one. Thank you.